If you think there's nothing to do in Newcastle and Lawrence County, then think again. Always stay connected to NCTV45 to receive the information on events going on in and around the area on a daily basis. Programs to view are Newswatch, The Morning Show, and Community Happenings. NCTV45 takes pride in bringing you the event and organization info that you want. NCTV45 is the #1 media source locally. NCTV45, anytime on your time.
Entrusting your loved one to a funeral director is a very personal and emotional decision. The funeral director you choose must understand the importance of the decision you have made. When you call the William and Roger DeCarbo Funeral Home, I recognize what a privilege it is to be chosen at your time of need. We will provide you and your family with the best service possible, with sincerity and compassion.
The William and Roger DeCarbo Funeral Home, family owned and operated since 1941.
Dine with us, come dine today. If you could use some real good food, there's a place not far away. If you could use a drink or two, or a place to go and play, come to Gallows Italian Villa today.
Simple elegance in a majestic setting. Yes, right here in downtown Newcastle, minutes away from shopping, seconds from a gas station, and let's not forget pastries, a restaurant, and oh yes, the schools. The majestic for that majestic lifestyle, right in the greatest castle, Newcastle. Come by and take a look.
24658-5900. Chuck Tanner would be proud of the restaurant that bears his name. Chuck Tanner's Restaurant, owned and operated by the Papazikas family, would love for you to be part of a Newcastle tradition. Come enjoy the great breakfast, super lunch, and second-to-none dinner choices from their Italian, Mediterranean, and American cuisine. You can relax with a wonderful atmosphere and something from the bar. If you're planning an event, ask about their banquet facility. Tanner's Restaurant is located at 2305 Wilmington Road in Neshannock Township. Call 724-65...
Good afternoon, Newcastle, and very pleasant hello to you as we embark on Newswatch. And well, our illustrious governor and the folks down in Harrisburg will be making a statement very shortly. And as I tell you, it's the Pennsylvania Comedy Show that taking center stage here this afternoon. We put out on our Facebook page the little political cartoon that seemed apropos as we talk about the governor, his policies, his Secretary of Health, and the bumbling, stupid decisions that were made on our way to being green today, which I'm not really sure what that means. But let's start with the swimming pools. Okay. The other day, he told you to make sure you rode your ATVs at least 6 feet apart. Now, do you realize how crazy that statement was? There's no end to his craziness. Water park activity is an integral part of the state park experience in Pennsylvania, with appropriate protocols in place to ensure safety and staffing permits. This department continues to reopen in state parks. This is Cindy Adams Dunn, okay, speaking. And avoid crowded parking lots and trailheads. Bring a bag and either carry out your trash and dispose of it properly. Clean up after your pets. Avoid activities that could put you at greater risk of injury, so you don't require a trip to the emergency room. Now, isn't that a bit of common sense? Cindy came up with that all by herself, as we're real proud of her for being able to figure that one out. To help avoid COVID-19, don't hike or recreate in groups. Go with those under the same roof and adhere to social distancing, staying 6 feet apart. Take hand sanitizer with you and use it regularly. They use it. I wonder if there's anything in their bottle. They use it at the beginning of their press conference. Avoid touching your face, eyes, and nose. Like somewhere on your hike, a squirrel could cough on you, and you could get the coronavirus. Cover your nose and mouth when you cough with your elbow. If you're sick, stay home. Don't go on a hike if you're sick. Really. They're amazing, folks. You can't get any more interesting or crazy than what they give you. Now, at 2 o'clock, the illustrious Pennsylvania players will be on. And we'll bring you their comedy routine. Now, here's what they're immensely worried about. Today in Pennsylvania, 693 cases. All-time total, 70,735. Basically, we're at the end of the month. So if we do a little perusing back and we go back to let me turn this page. here. This is May 2nd. 48,305. Okay, 46,971. So 47,000 minus the 70,000. That's 23,000. We've not subtracted those who died out of this because she doesn't put it in her report. Total deaths, 3,500. Okay, so 47, 50, 20,000. Do you realize how small the numbers are? Their press conference, like I said, at 2. And we send in questions for them. They don't like, apparently, our questions. The president signed into law the CARES Act, which includes relief for workers affected by coronavirus. Sections 2107. The CARES Act provides pandemic unemployment insurance. PUA is a temporary federal-based program and provides 39 weeks of unemployment benefits for individuals not eligible for the regular. So check it out if you're self-employed, just so that you have an idea. Now, as we continue on, and my little stopwatch says it's time to check on the boys. And they're starting soon, so we're going to keep it there. Okay, and matter of fact, I'll take it right back. State Fire Commissioner announces Act 13 Unconventional Gas Wells Funding Grant Program. And Unconventional Gas Wells Program grant was announced. Eligible projects, grants provided to include development, delivery, and sustainment of training to help fight those kind of fires. Primary, Tuesday. You must wear a mask, wash your hands before and after voting, bring your own blue and black pen to use, social distancing, follow poll workers' instructions. There you go. So when you vote, okay, and we'll read that again to you. So let's check out Harrisburg. And they should be starting. They're always a little late. And what a comedy show they'll have planned for us today. Now, slightly after 2, and their feed should be coming through momentarily as we'll give you little heads up on. Oh, there they are. Let's go straight to this.
So thanks everybody for joining me today. I just want to thank you especially. We're trying to all of us cope with the COVID-19 virus, and this is the first, as of today, Dauphin County is now in the yellow phase, so this is the first chance we've had to be together, and I appreciate your forbearance as we've gone through this together, and appreciate your willingness to come in here and be with us. Before we get to the coronavirus, I just want to make a comment on what happened out in Minneapolis, and I want to make sure that I share my condolences and the condolences of everybody in my administration with the family of George Floyd. And it reminds us what we need to do here in Pennsylvania as well. This happened in Minnesota, far away, a different state, but every one of us, each and every one of us in Pennsylvania has a stake in making sure that our society is fair and we treat everybody equally. If some of us are not free, if some of us are not treated equally, all of us are in jeopardy. We need to do this every day. We need to recognize this in every corner of our society. So again, even though this happened in Minnesota, this has relevance for us here in Pennsylvania. Racism is not right there, it's not right here. And we've got to do everything to make sure that especially the Commonwealth of Pennsylvania is welcoming to everybody. Now I'd like to update you on the response to the pandemic. Today, the first Pennsylvania counties moved into the green phase, as you know, in the COVID-19 recovery. Next week at 12:01, Friday, June 5th, 16 more counties will move from yellow to green. They are Allegheny County, Armstrong, Bedford, Blair, Butler, Cambria, Clinton, Fayette, Fulton, Greene, Indiana, Lycoming, Mercer, Somerset, Washington, and Westmoreland counties at 16. And every county that is currently in the red phase is slated to move into the yellow phase at the same time, 12:01 on Friday, June 5th. That's Berks County, Bucks, Chester, Delaware, Lackawanna, Lancaster, Lehigh, Montgomery, Northampton, and Philadelphia counties. We will continue to monitor these counties, and we'll keep talking with local officials so that everyone feels comfortable as we move toward reopening. Again, the goal here is to make sure that every Pennsylvanian is confident that they're going to be safe moving from one of these phases into the next. Once again, we've selected these counties based on the recommendations of medical and epidemiological experts. We've been able to do this because of the precautions taken by Pennsylvanians. We've had some great success here. Things like wearing masks, as you're all doing, and the work of our hospital systems and our local officials. I think you know this, we've increased our testing to up to the high point a couple days ago, 13,000 tests per day at more than 300 sites around the state. And this is important because it's not just the number of tests, but how accessible are those tests to Pennsylvanians. We have more test sites than any other state in the United States, and we keep figuring out ways to open more. We've also expanded our contact tracing to allow a case investigation right now of every single new and diagnosed case. Because of this, we're able to take important steps to return to a sense of normalcy again, as we remain careful and vigilant. Counties moving from the red to yellow or yellow to green will see more businesses reopen and more activities resume. But it is important that we continue to act with caution, especially as we reopen. Let's remember how quickly this virus spread back in March when it first arrived, because we were not yet taking precautions. We weren't wearing masks back then. We weren't exercising social distancing. We weren't staying at home. We needed to buy time, and we did that. But before we bought time, before we were successful, we saw 6 weeks of exponential growth of this virus. When we isolated ourselves to limit the likelihood of transmissions, we succeeded in reducing our new case count, and we succeeded in reducing the rate of hospitalization. We also increased our testing, and that helped. But we can't isolate ourselves forever. We can't do that forever, and we still don't have enough tests. We still don't have a vaccine. So we need to continue to be careful. That's the point. At our peak, our daily new case count topped 2,000. That was back in the beginning, back in March. Now, even with increased testing, increases the denominator, and reopened businesses and activities, our daily count is now below 600. It's well below 1,000. And our contact tracing capabilities are growing daily, which is allowing for an increasing number of Pennsylvanians to resume activities without unknowingly contracting or spreading COVID-19. Again, all of this won't be enough if we don't, all of us, 13 million Pennsylvanians, continue to take simple but important precautions to prevent the outbreaks and spikes in cases. Again, one of these precautions is wearing masks. Some reason, I don't know why, wearing masks has become politicized, even though scientific studies have shown that it actually reduces the likelihood of spreading COVID-19. In fact, one study found that wearing just a tea towel around your nose and mouth reduces the spread of droplets by 60%. This means fewer infections, and fewer infections mean fewer outbreaks and fewer spikes in cases. It'll mean that our lives can return more quickly to the normalcy that we all look forward to. We also need employers to be responsible and diligent. Most of them have been, and I thank those employers for doing their part to keep their workers, their customers, and their families safe. We need you to keep being responsible. If employees are sick, encourage them to stay home. If your workers, notify your workers and take steps if their fellow workers are sick. Take steps outlined by the Department of Health to keep your workplace safe by sanitizing surfaces. If all of us take the simple steps of wearing a mask, staying at home when we can, especially when we're sick, and practicing social distancing tactics, we're going to all work together to succeed in eliminating the spread of COVID-19. It will make a huge contribution to getting our Commonwealth back on track. So thank you very much again for all of you being here. Now I'm going to turn things over to Secretary Levine. Dr. Levine.
Thank you, Governor. Here is our latest update on COVID-19 in Pennsylvania. As of 12 a.m. this morning, we have 693 new cases of COVID-19. This brings our statewide total to 70,735 Pennsylvanians who have tested positive for COVID-19 in all 67 counties. Tragically, 5,464 deaths have been attributed to COVID-19. Statewide, we are now estimating that 64% of people with COVID-19 have recovered. As more counties move into the green and yellow phases, we all have an important job. We need to stay alert. Please be alert to your surroundings when you leave your house and you go out. Plan on how you're going to maintain social distancing. When you go to places where there's going to be a lot of people, that could be the grocery store, that could be the pharmacy, it might be other stores as we go into the yellow and the green, or it could be work. If you can't social distance, actually consider whether or not you really have to go. And just like before, just like you remember your keys and your cell phone before you go out, add a mask, add hand sanitizer to that list. When you get together with friends or family, try to stay outdoors as much as possible. The weather is getting much better. Please enjoy the beautiful summer weather. Make sure your children have a mask and know how to properly use it. It's going to be harder for them to keep social distancing, but it's important to keep them safe even when they're playing. While we can resume some of our regular activities, it is important to be alert to the fact that COVID-19 has not gone away. Be aware and alert, and that will keep you, your family, and really all of us safe. Now, here are my daily reminders. Please wash your hands with soap and water for at least 20 seconds, or the time it takes to sing Happy Birthday twice. Use hand sanitizer if soap and water are not available. Cover any coughs or sneezes with your elbow, not with your hands. And please don't touch your face, especially after touching surfaces. Clean surfaces frequently. And if you have to go out for life-sustaining activities or other activities now, please wear a mask if you're going to come into contact with others. If you have questions about your health, please contact your health care provider. If you need mental health resources, because you or someone you know is experiencing a mental health crisis, please contact the crisis text line by texting PA to 741-741 or call the statewide support and referral helpline at 1-855-284-2494. Again, 1-855-284-2494. If you or someone you care about needs help with a substance use disorder, please call the Department of Drug and Alcohol Program's Get Help Now hotline at 1-800-662-HELP. Again, 1-800-662-HELP. For the most reliable information related to Pennsylvania's response to COVID-19, please visit our website at health.pa.gov. And what is most important for Pennsylvanians to remember is stay calm, stay alert, and stay safe. And now the Governor and I are pleased to answer questions.
Sarah? Oh, I'm sorry.
Lizzie.
Sorry, Lizzie.
Yeah, no, thank you.
It's the masks.
I want to ask about testing. So this month I think there were only 7 days when Pennsylvania hit its goal of reporting 8,500 tests per day. So I understand that there's still backlogs in testing. Can you explain why we haven't met our monthly goal? I think with 2 days left, we still have like 20% of our kind of monthly quota to meet of testing 2% of the population. So what's the holdup, and is it really safe to open the state in a week if we can't do this kind of thing?
Well, first we have a phased reopening, so it's not everyone's going to green. It's that all of the counties will be in yellow. But we have been doing much better in terms of our testing. We have much better testing capacity than we had before. We have been working with the federal government in terms of getting the swabs and the media, which they deliver actually to us, and we push out throughout the state. In addition, the companies are doing much better in terms of getting not only us, but hospitals, as well as commercial laboratories like LabCorp and Quest, the different materials need to use for testing. Basically, we have increased our testing from 3,000 to 4,000 tests a day to 5,000 to 6,000 tests a day to now regularly 10, 11, 12, 13,000 tests a day. The number went significantly down over the Memorial Day holiday. And so all of the testing went down over that time. Really, that's because the public didn't come out for testing. I mean, those pharmacies are available, hospitals are available for doing testing. We're continuing to increase our testing at long-term care living facilities. There are now 45 facilities that have tested everyone, but the numbers went significantly down. They always go down on the weekends, and they went down on the holidays. We're going to continue to work to expand that.
Okay, can I follow up? So, when you set this benchmark a month ago, though, it seemed modest even by the standards that health researchers are recommending for a state of our size. So, were there unexpected hiccups that you encountered this month that prevented you from meeting the benchmark that I think a lot of people expected would be pretty feasible?
I think the biggest challenge that we have right now is that the numbers go down from 13,000 a day to like 7,000 or 8,000 on the weekends. And so we're going to need to do to make sure that we continue to get people out who have symptoms, or anyone now, to get tested on the weekends. We have the capacity to do it on the weekends. We just don't have the people going out. That's specifically challenging on holiday weekends, so you have a 3-day weekend. But we want to continue to expand our testing. We're working with CVS. We're working with Rite Aid. We're working with Walmart and Quest. We're working with other pharmacies, as well as some walk-in clinics, etc., to be able to expand testing. We want to make it accessible and available to the public, in addition to going to the doctor's office or the hospital, and the mass testing site is still open in Montgomery County, but we want to make it accessible to people in the community. We also want to do specific outreach to vulnerable communities, and working with the Lieutenant Governor's Task Force, as well as our own work group with the Department of Health. We have various ideas about how we're going to target certain vulnerable minority communities to make sure we get testing there too.
Even though you're not meeting the benchmarks, do you have enough data to make the decisions that you're making about reopening?
Yes, we have enough data to be able to do that.
Could I just add something to that? One of the problems is it's sort of a moving target. We're not even close to the point where we have enough tests to do surveillance testing, where anybody who wants to have a test can. Right now, you have to have some symptoms, some sense that you need to have a test. We also have the challenge of making sure, as the Secretary said, making sure they're accessible. So one of the things we've done to that is it's not just a matter of having the ability to provide the tests, it's the ability to do them in areas. So we have, 318 testing sites now spread throughout most of Pennsylvania, not every county, but almost every county. Those are the kinds of things we have to do. I think until we get to a point where we can do surveillance testing for everybody, which is way off in the future. I mean, we have 13 million people. That would probably require a test, at least once a month. I don't think we have any sense of what that actually means. But we are in a much different and better place now in terms of the spread, the accessibility of these tests, and the ability of someone just to walk into a CVS and say, I'd like to have a test. You couldn't do that 4 weeks ago. You can now. So we are moving toward that. There are going to be ups and downs as we move toward that. Some of these downs will be as a result of people just not making the decision to get a test. It might be because the number of people experiencing problems is down. All these things are going to affect the number of tests that we actually do, but our capacity is much greater, and I think we're comfortable that it's moving generally over a period of time, weekends accepted, in the right direction.
Is it like a supply and demand problem? Like, do you have an ample supply of tests, but you're saying people are not seeking them out?
So 4 weeks ago, the answer would have been no, we don't. Now, again, for what we're testing, I think we feel a lot more confident. In terms of surveillance testing, we are a long way from being there, where anybody can get a test and where we have a test that actually can be turned around quickly. We're working on that. We keep talking about a plan to do short-term tests, but also what's the aspirational plan. And testing one way or another is going to be at the heart of whatever we do to try to make people comfortable going back to work, going back to the store, going back to school. Until we get to that point, we're not going to be a good place. We are not there yet.
All right, Ed, then Sarah.
Governor?
Yes.
Hi. Last night, the House of Representatives passed a resolution to partially terminate your disaster declaration.
Right.
8 Democrats joined them. What's your reaction to the 8 Democrats joining that resolution effort? And overall, what kind of pressure are you feeling from members of your own party to reopen businesses more quickly?
I mean, I'm getting pressure from all over the place, including from myself. I'm frustrated by where we are. The challenge we've had, the first challenge we had was to keep the outbreak from overwhelming our healthcare system. And that's what we did. And that's why the numbers are doing what they're doing right now, because we were successful in buying time. So we have the capacity, we have testing capacity we didn't have before. We have the ability, I think we have 300 ventilators in use. We have 5,000 that are out and about right now, but only 300 are in use. 2 months ago, we were concerned that especially in certain parts of the state, we'd be overwhelmed. We're not overwhelmed now. So we are reopening. I think we're reopening in a measured way, but I think everybody's frustrated. Everybody wants to get back. I want to get back to as close to normal as we can be. So I recognize the frustration. But again, this is not a matter of me saying I'm going to wave a magic wand or flick a switch and we're going to be open. It's a matter of how do we get people to feel comfortable and confident that they can go back to life as they want it to be in this new post-infectious disease world. That's what we're all struggling with. So when someone expresses frustration, whether it's voting in a way that I don't agree with, I don't care if they're Democrats or Republicans, I understand it. But that's not going to help in terms of getting people to actually feel comfortable. We're trying to do everything we can to say, here are the guidelines. Here's what we think we ought to be looking at in terms of moving into less restrictive territory. If we don't follow these guidelines, we're taking risks with that virus. That's the enemy, not me, not Donald Trump, not a member of the House of Representatives or the state Senate. It's that virus. And what we're all trying to do in this new territory that we find ourselves in is trying to defeat that virus.
And you'll veto that if it gets to you?
If it gets my desk, yes.
Sarah?
Yeah, I want to follow up on, this is Sarah Simon with Spotlight PA. I want to follow up on Lizzie's question about testing, because I'm sitting here crunching the numbers right now, as I have been doing over the past month. And nowhere do I see that the state of Pennsylvania got up to 13,000 tests. I'm wondering if you can explain that. Because here's what I'm doing. I'm adding the number of negative PCR tests every day with the number of total cases in I see a high of 11,250 on day 21st, but I see over the past 2 weeks that we've hit about 8,400. So I'm wondering, where does that 13,000?
The 13,000 was reported to me. So
where does it come from, and does it include antibody tests?
So it does not include antibody tests. This is only including the PCR tests. And so we can have our team do a deep dive with you on that. It has to do with the individuals who have been tested, and some individuals have been tested twice, but it's only going to show up on your data that they were tested. It's individuals who were tested, and so if someone was tested and they were tested again, either as to see if they were positive, if they had symptoms, they tested negative, well, they have more symptoms, they're tested again, or if they were tested to see if their COVID has gone away. It has to do with the people who were tested. So we'll have to have somebody sit down with you and do a deep dive, but we're very confident in our numbers. I understand that if you just add up the positive negatives, but it has to do with how we report our numbers.
So then does the number 13,000, is that misleading? Is that giving people a false impression of
No.
the current spread of the virus?
No, I don't think it's giving a false impression at all. I think that
to the extent that it raises the denominator, more people are being tested. You might say you could say if the infection rate stayed the same, you would see an increase in case count. What we're actually seeing is a decrease in the percentage of people who are testing positive.
So that's a very important point, is that one of the things that we follow really closely is the percent of positive tests. So what percent of all the tests that are done are positive? That has been going down significantly since sometime middle of April. So now, just from a statewide, it's less than 10%. And so that is a very important factor in terms of the amount of COVID-19 in the community, and we know that on a regional basis as well. And so we actually even know that from a county basis. So we know that the percent positives of the tests have been going down significantly throughout the state, even in the Northeast and the Southeast. And that's a very important factor that makes us comfortable in terms of going from red to yellow in the Southeast.
Barbara and then Sarah Gillette.
For Governor Wolf, we saw over Memorial Day weekend some events that had crowds. Carlisle Events says right now it's planning to go ahead with its car show June 17th to 21st, which would draw tens of thousands of people. Also, there was a large crowd at Lincoln Speedway. They're planning to race this weekend, yet Williams Grove is not tonight. I'm wondering if you can weigh in with some guidance on these large events as we see them starting to be set.
Yeah, again, as a former business owner, I think I would do everything in my power to keep my customers, my employees safe. And to the extent you bring people together in close quarters where this infectious disease can spread more easily, you're playing roulette with the health of your employees and your customers. And I don't know why you'd want to do that.
Sarah Gillette.
This question's for the governor from WBRE.
Sarah.
Sorry. Concerns have been expressed by many voters and County Election Bureau officials around the Commonwealth that election results Tuesday may be delayed or late coming in because of the large number of vote-by-mail ballots. What's your response to those concerns, and what actions, if any, has the Commonwealth taken to address those concerns?
Yeah, no one knows at this point. This is the first time that we've had this many people vote by mail. Typically in an election, presidential primary election, you have maybe 200,000 votes that come in by mail, the traditional absentee ballots. Right now with Act 77, on a bipartisan basis, there are almost 2 million people voting by mail or have made application. And so every county is I think, working hard to deal with this. The General Assembly did move the counting start from the end of the closing of the polls at 8 o'clock on election day to 7 a.m. that day. So that gives them a little more time, but and so no one knows how long this is going to take. I would bet that there will be some delays, that it will take longer to bring the vote in than it would come in if everybody went to the polling station one day, especially with the new electronic votes. It'll probably take longer. At this point, no one knows. This is the first time we've ever done this. And I think for the most part, counties have done a good job. I know I'm voting by mail. My wife is voting by mail, and we both made our application, both got our ballots, and both sent them off.
Thank you.
Jan and John Kennedy.
Hey, Jan.
I was wondering if you could comment on the numbers diagnosed, the health numbers diagnosis being disclosed this week and how it was handled. It seems like there's a general feeling among the legislators, including now some senators, saying that when someone in the Capitol is diagnosed, that needs to be not necessarily the individual's name widely known, but the fact that there is a case because of the interactions that happened. I was just wondering if you could comment on that.
Yeah, I mean, again, it gets back to being an employer with 70-some thousand employees in the state, a lot of whom work in buildings in Harrisburg, and I think something like that leads to concern on the part of our employees. I don't know exactly what happened, but I can see why members of the General Assembly would be concerned.
And if you were diagnosed, would you self-disclose immediately?
Yes.
John and then Ford.
Hey, Governor.
Hi.
Just obviously living across north central Pennsylvania, much of the region is going green.
Right.
And there are exceptions. So those of us who were in green counties are happy, and those of our neighbors are unhappy. Union County is kind of sticking out like a thumb at this point, sort of between Snyder and Lycoming and some of the other areas. Do you have any explanation for why that county kind of got left behind?
Yeah, let me, and this is changed. So this is as we learn more, we used new techniques. And I wrote this down so that there's no confusion. We look at three things right now. In terms of determining whether a county can move from one phase to the next. We look at higher rates of new cases in the past 7 days. If that's declining over a 7-day period, we like that. Second, over a 14-day period, if there's an increase or decrease in the percentage of positive cases, again, as we see a decrease in the percentage of positive cases, that's a good thing. And then third, we're looking at outbreaks that can't be managed with contact tracing. So if an area has an outbreak for whatever reason, and it doesn't look like they have the capacity to deal with it, that's a concern for us. Right now, those are the three things that we're looking at. So I can't speak specifically to Union County or any of the counties, but as we move from one place to the next, and if we ever move from, say, green back to yellow or yellow to red, these are the things that we're looking at. Again, the effort is to try to keep people safe. It's not to try to poke holes or make political judgments. It's saying, yeah, okay, you either do have the capacity, you're either going in the right direction or you're not. If you're not, that's a problem, not just for me or for you as a county commissioner, but for the constituents and the citizens who live in that area. So we're just trying to do what we do when Republicans or Democrats do a county health or a health check at a restaurant or a fire check to see if you're staying within your capacity. All those things, those are efforts to try to do what we can to give guidance to keep people safe.
Could you shed some light on the sort of the logistics of the decision making? Because you obviously have this meeting where you have your experts and your cabinet tell you things. And
yeah.
Are you vetoing counties, or are you just accepting what they're telling you?
Me, I'm accepting. The decisions that these folks are coming to me with are not political decisions. These are decisions based on the three criteria right now that I'm talking about. Tomorrow it might be different. You know, we might learn some new things, but right now this is what we're dealing with. As you recall, back in the early days, we didn't have a lot of data. We were looking at fairly crude measures like how many cases per 100,000. Well, some of that depended on how many tests, what your testing capacity was. I think we're getting better and better at this. The hope is a month from now we'll be even better.
Ford, Denmark.
Hi, Governor. Thanks for doing these in-person
Sure.
presentations again. This is a follow-up on John's question, really. The metric that was one of the first things you talked about when your reopening plan was unveiled was 50 new cases on average over a 14-day period per 100,000. I guess part A of the question, is that off the table now as far as...
No, I think we've, as I said to John, I think we've learned more and we have a better access to data. When we didn't, that was something that was, I mean, obviously I still, maybe you can talk about, I'm not sure how we picked the 50 out of 100,000. Could have been 53. I mean, but we picked 50. Now I think we have access to more data, and we can be a little more subtle and sophisticated in what we do, but maybe you want to talk about that.
So the 50 per 100,000 is an incidence rate, right? It's a per incidence rate per capita. And so that was really important, especially when our testing was not as sufficient as we were talking about. I mean, then we were doing sometimes 2,000 or 3,000, maybe then 4,000 and 5,000 tests. Now that we are up to doing, you know, over the last number of days, except for the holidays, 10, 11, 12, 13,000 tests a day. Using an incidence rate is not as valid of a metric because you have more tests. The 50 per 100,000 was picked because that is the definition of a moderate rate for the CDC.
Can you speak to the counties that are going to go yellow next
Friday?
A week from today.
Right.
Mostly in the southeastern corner of the state,
Correct.
including Lehigh and Northampton, who have been using this sort of, when they think of metrics, that's the one they think of, and when they go yellow, they're going to still be way above it. Some of them.
Correct.
Do the people who have been sort of waiting and sort of looking at the science to guess when they're going to reopen, do they have a reason to be frustrated? Like, couldn't we have been open sooner?
Well, so as the governor was saying, our metrics have evolved, right? And they're going to change depending upon the situations on the ground. And so using that, it was never that one incidence rate. I mean, it was one of the things we looked at, and people glommed onto it because it's a specific number. I would also highlight the data from the Carnegie Mellon University, and that's available on our website. There are also trajectory animations, which are the number of new cases over 7 days. Those are really interesting animations that are available on our website. We also have used modeling. We haven't stuck with any one model. We understand perfectly that a model is just a model. There's modeling, and there are many different models that we've looked at. There's the University of Pittsburgh School of Public Health model. There's the Children's Hospital of Philadelphia policy lab model. There's a new Penn Wharton model. There's the model from another group at Penn has done a model. There's also the model from the University of Washington that's been used federally a lot. There's not just one model that determines that. And then we have CMU, and then we look at exactly the things that the governor was talking about in terms of the rate of change over 7 and 14 days, the percent positivity rate, which was very high in the past and has gone down very nicely, and so those are all the different things that have gone into our decision, but using that specific incident rate no longer was relevant, and so that's why we're not using it now.
Let me just add something.
Yes, sir.
Let me just add something. Again, we've got to keep reminding ourselves that we're not in conflict. We're not running up against some abstract numbers or politicians. We're fighting that virus. And we continually look for better and better ways to try to figure out what that virus is doing. We know that virus is sneaky, that it wants to infect us, wants to make us sick, and if it can, kill us. And we want to try to defeat that virus. So all we're doing is focused on what it's going to take to defeat that virus. So if you're out there and you're looking at what we're doing here and saying, I think we should be frustrated that we didn't move faster, well, it's not us. We're doing the best we can. What we're all trying to do, and what every citizen of Pennsylvania is trying to do, is defeat that virus.
Mark, then Dennis.
Hello, Governor, Madam Secretary. Thanks for having us. As you know, there seems to be a wide expectation there will be a resurgence of the virus in the fall.
Right.
Could you provide us an update on the planning for that, including hopefully specifics about schools? Is there a date, for example, by which parents will know whether or not they're going to have schools open?
Well, we are going to be opening schools, whether it's August or September. That depends on the local school district, but we're working on. No question. The guidelines are now. The schooling will look different. I mean, you'll probably have more online learning and maybe less classroom learning. There might be fewer students in each classroom on average, that kind of thing. So it probably will look different. But the Department of Education is working on those guidelines, and I think they should be out early next week.
Yes.
What about other planning for the fall? I mean,
we're planning for the fall, for exactly what you said. We don't have the plan. I think we're hoping to have, maybe, Rachel, you want to talk about that, but we are, and the couple of things that we are assuming. First of all, we cannot do a lockdown. We cannot do a shelter in place. That's just not going to work. But what do? We are going to have more capacity in our healthcare system. We're going to have the ability to do more testing. We're going to have some things. We're probably not going to have a vaccine come the fall, come the coming flu season. So all those assumptions we're bringing into the plan, and we're working on that every day. But maybe you want to talk about that.
So as the governor was saying, we are actively making plans for the fall. So I'm going to talk about the public health response because that's what I'm responsible for. We want to expand testing much more than we're doing now. We are hoping for but we'll see. But I'm optimistic. A rapid, accurate point of care test. That can be done very simply from not a nasal pharyngeal swab. If you haven't had one, it's not as much fun as it sounds. But just a nasal swab or an oral swab that can be done. You can have a rapid test done often by a person that's not a healthcare provider, maybe even a home test. And that the results are in 15, 20 minutes, and it has particularly a very good sensitivity. Sensitivity means it has a very low false negative rate. If you have a screening test, it's really bad to have a lot of false negatives because that means you're missing a lot of different people, and that's bad for a screening test. So we are hopeful. There are many companies, Pennsylvania companies and companies outside of Pennsylvania working on that test, and so I think that will be very helpful. It's not absolutely essential, but it'll be really helpful to have that. Even now, it takes 24 to 48 hours to get a test result back. That's less useful for the type of things the governor is talking about for businesses and for schools, so we'll see. In addition, it might be that antibody tests will be useful. There are many different things we have to know about antibody tests. One is, are they accurate? Right? Do they have a good sensitivity and specificity? We don't really know that now for many of the tests. And how protective are those antibodies? There is some suggestion in the literature that the antibodies are protective against COVID-19, at least partially protective, but we don't really know that yet, how long-lived they are. Hopefully, in the next 3 to 4 months, we're going to know a lot more about the accuracy and the meaning of the antibody tests. So very widespread testing, very intensive case investigations and contact tracers. We're going to be looking for several thousand contact tracers throughout the state. And again, that's not just us, it's working with our county municipal health department. So if someone tests positive, we immediately do case investigation, we immediately do contact tracing. Those people are isolated and quarantined, and we can stop outbreaks. That's what many of the countries did in Asia that were successfully able to prevent the kind of spread that we saw in the United States. So that's our goal for the fall.
I would like to follow up with the governor.
Yes.
I just want to make sure I understand what you're saying about the shutdown. There's absolutely not going to be another shutdown, not like one county if there's and that's forever. You're never doing this again, no matter how bad it gets.
No, I'm saying that the goal is that we don't do that. The assumption is that that's not an option. We want to do everything in our power to avoid that, and we will.
Dennis, Fox 43.
For Secretary Levine, if I could.
Yes.
So as you know, this week a Republican lawmaker tested positive, and some Democrats were upset that they weren't informed, and I'm told that those Democrats chatted with you and laid out the scenario, and that the word I heard was that you said, well, it seems that they followed the proper protocol, meaning leadership at the House. Is that accurate?
Well, so I absolutely spoke with the Democratic caucus. I'm very pleased to speak with any legislators that I do all the time. And I outlined what our policies and procedures are for a positive test. That if you have a positive test in a business about how the Human Resources Department is notified and then they do their investigation, that the Department of Health is notified. I mean, we know every positive test, and with every positive test, we do case investigations and contact tracing. I can't talk to specifics for obvious reasons, but I can tell you that we perform those functions.
But this is obviously going to become a problem now. Now we're in a COVID-19 world for employers. Is there some guidance you can offer them as to, because obviously you have to balance privacy versus safety of other people? Sure,
there are guidelines for employers and what they should do, and that's both in the government and outside the government. And to be honest with you, HR directors know exactly what they're supposed to do. But then the Department of Health, all I can say is we investigate every test, and we do contact tracing with every positive test in the Commonwealth.
Fox 43 and then 21.
Dennis had kind of covered it, but the HIPAA laws, you're saying, do not apply to businesses? or they do?
Well, so when they, I mean, with the way we do things and the way businesses do things is that they don't, if we do contact tracing, we don't call up somebody and say, you were exposed to John Smith. John Smith has COVID-19 and you were exposed to John and thus you should quarantine. When we call up, we say, you were exposed to someone with COVID-19. We know that is to be true and you had close contact with that person and you need to quarantine. And so confidentiality is maintained.
So then going to the state lawmaker who tested positive, should all state lawmakers have been notified? They said that they only contacted ones that they knew were in close contact, but some Democrats said that they were in close contact and weren't notified.
So I can't comment on any specific case, whether that case was in north central Pennsylvania, or in the capital, or in Washington County. I cannot comment on any specific case. I can just tell you what our procedure is. And we always follow our procedure.
For regular business, what are the guidelines then for them? If one employee does test positive for COVID, should all employees be notified that work?
No. So if an employee tests positive, then they will talk to an employee the way it's kind of parallel actually, talk to someone who's positive. They will identify who close contacts are and they'll ask close contacts to quarantine. They don't necessarily, I mean they can if they want to, but they do not necessarily have to close a large business because one person tested positive. That would be unusual, is that if one person in a large company tested positive, they would close the whole company. If they have an outbreak, they will. But usually it would be on an individual basis in terms of not everybody was a close contact. And so close contacts will be notified and then asked to quarantine, and all that is done confidentially.
And then Sarah Goulet.
Dr. Levine, nursing homes were on lockdown early in the crisis. How is it acceptable for them to have the most deaths in the state? And how are so many new cases brought in the first place?
So new cases occur in nursing homes because fantastic staff are asymptomatic or maybe pre-symptomatic, and they live in the community. Right? Staff live in the community, usually in the same county, but maybe not, and they are working with their patients and are working in a nursing home, and they bring in COVID-19 because we know that asymptomatic individuals can carry the virus. And so we know that long-term care living facilities are our most vulnerable citizens because they are, for the most part, seniors, and then seniors with chronic medical conditions, and those are the most vulnerable for COVID-19. So that's how the cases are brought into nursing homes. We have contacted every single long-term care living facility that has had positive cases. We do many different outreaches to that through our team. If there's more outreach necessary, then we have a contract with ECRI. They testified at a hearing a number of weeks ago before the House in terms of their work with the facilities. If there is a potential violation we're concerned of, then we do our usual investigations by our QA staff. Not every case is a violation. I mean, again, that happens because of the asymptomatic spread of COVID-19. But if there was a potential violation, our staff will do either a virtual or, if necessary, our QA staff will don PPE and they will go into the facility. And all of that has happened. We have educational seminars from the Patient Safety Authority. There are other groups that do educational seminars as well. And then if there are significant staffing issues, then we send in the National Guard to be able to help. And that has been done, I'm forgetting the number now, but many, many times now where we've had the National Guard go in. We've had two CDC strike teams that have been here. One has left, but one is still here that has gone into nursing homes. And now we have Health and Human Service public health officials that are being trained to go into facilities as well. So we have done absolutely everything that we can to protect the citizens and the patients and the staff in these very vulnerable long-term care living facilities, and we will continue to do that. We have also pushed out, I think, 1,800 specific pushes of PPE to these facilities. In the last month, those facilities have been our priority for pushing out PPE. So we have absolutely done everything we can for these facilities.
Sarah Goulet, and then Barbara.
Questions for the governor? Governor, this question is from the Philadelphia Inquirer. With gatherings of more than 250 people prohibited in the green phase, who will be responsible for enforcing that? Is it on business owners and individuals? Would state police be authorized to break up groups of that size or cite people who gather?
Yeah, I guess state police will have the ability to cite, but I liken this to stop signs. We all have stop signs. Anybody ever sat by a stop sign and watch how many cars actually come to a full stop? None. None. Now that's a law. And so enforcement could take place and they could be cited for actually not coming to a full stop at a stop sign. The reason stop signs work is because we self-enforce. And so we do have a guideline that says 250 people is the cap. You shouldn't be going beyond that or you're tempting fate. And if you go through a stop sign, you're tempting fate. You might be able to get through it. You might. And maybe in the most cases you do, but it's your choice. The enforcement is self-enforcement. And here, that's what's going to work ultimately. It's not going to be whether the state police issue citations. They can, I guess. It's not whether local law enforcement move in and say you can't come together, there are too many of you. I guess they can. But ultimately, it's going to be because business owners, individuals make decisions in their own minds that they are going to abide by the dictates of this virus that says you bring a lot of people together, I'm going to get you. You might be able to dodge this bullet, but you're increasing the risk of danger. What's going to, I think, work in yellow, in green, whatever the guidelines are. This is a self-enforcement. 13 million Pennsylvanians have to recognize that we're all in this together. We're all fighting the same common enemy, and we got to do the same things. Yes, Sarah.
Barbara, then Ford. Governor, just a couple of questions, sir. With sportscast being able to open in green phase counties and talking about school opening in the fall, have you been in touch with the PIAA about high school athletics?
I haven't been. I think people on my staff have been. I've been in touch with professional sports, including NASCAR, the NFL, NHL, Major League Baseball, and others, but I don't know all the contacts that my staff has been. Again, what we're all trying to do is develop, mainly in conjunction with these sports groups, guidelines to say, what are we going to do? And they want to do the same thing. How do we keep our participants safe? How do we keep our staff safe? How do we do the things that people want us to do while keeping all of us safe? And that's what we're trying to do, work out guidelines.
You say schools will look different. Do you think high school sports in the fall would look different at this point?
I think everything's going to look different in the fall. I mean, I don't know. I mean, what does a whiteout at Penn State look like in the fall? 120,000 people packed together. Can we do that and stay safe? We're all working with that, and I got to say, and the folks at Penn State are working with that. And I think every single high school and middle school and elementary school in the Commonwealth is thinking about how can we get back to as close to normal as we can be, but keep people safe, keep the parents safe, keep the staff safe, keep the kids safe.
Ford?
Hi, Governor.
Yeah.
I wanted to follow up on a question I asked a week or so ago about Southeastern Veterans Center. The Attorney General's been asked to look at what happened there, and as is typical, he won't comment publicly on whether he is doing that. But a lawmaker has told me that during a state-level meeting, it was mentioned that a separate investigation by the state is going to take place, or is likely to take place. Can you comment on that and on any loss of confidence people might have in the system, the DMVA system of veterans homes?
Well, we're certainly looking into the problems, and we want to make sure that to the extent there are, that we do something about it.
And can you say anything about the DMVA system, all the veterans homes and the people who are associated with that one?
We're doing everything we can to make sure that we keep the folks who are there safe. And to the extent that we get information that says that we could do better, we are taking that information to heart.
Ed, and then Jan.
Just to follow up on the school issue, you said they will reopen. Just to be absolutely clear, like physically reopen. You're confident that schools will physically reopen? That's
our plan. Yeah. No, I mean, something might happen. Schools. Yeah, that something might happen. Yes, there's an opt-out fate clause here that if a comet strikes, but we are doing everything we can to make sure schools are open on time in the fall.
And then why is the shelter in place doing that again? Why is that so bad? Why is that such a bad?
The shelter in place?
Yeah.
No, I think, I don't know how you felt about it, but it was frustrating. And I think it's a really great thing that people have done that. But if we can figure out a way to keep ourselves safe without having to resort to those draconian measures, I think we ought to do that. Again, we resorted to those draconian measures because we were really concerned about a healthcare system that would be overwhelmed, as it was in parts of New York, as it was in Italy, as it was in parts of Spain. We didn't want that to happen in Pennsylvania, and we avoided that. It might have happened. I think Drexel University did a study that said doing what we did as early as we did, as decisively as we did, saved 7,000 lives. I don't know where they got that information. That's Drexel University, but that's one city in one county in Pennsylvania where we saved 7,000 lives. Maybe we saved more by doing that, but I don't think anybody would argue that that is something that we all loved, that our economy really came to a grinding halt. That's not great. So as we move forward, as we get more capacity in our healthcare system, as we learn more about this disease, the hope is that we can do much better at balancing the competing needs of getting people back to work, getting back to school, getting life back to interacting with their loved ones in this new post-infection infectious disease world, but do that in a way that does not require us to do things as draconian as sheltering in place. Again, the virus keeps telling us that to the extent we can do that, we're reducing the risk of infection. But I think people actually want to interact more. They want to go to stores. They want to go to school. They want to do those things. And I think everything we ought to do is try to figure out how, with what we have, we can do that.
Jan has our last question.
And kind of building off of Deb's question, and this could be for either of you, now that you dropped a hint that there's going to be some guidance coming out to schools for next week,
I don't think that's a hint. We're actually actively working on it. I think, I don't know if Sarah or Lindsay can confirm, but next week, I think early in the week, we will have those guidelines. The Department of Education has been working on that for a number of weeks now.
And so can you, because parents and teachers are anxious, I mean, we saw that one report saying a fifth of teachers are reluctant to go back to school or teach.
Right.
And so just can you tell us what this guidance is going to talk about, the transportation?
It gets back to the same thing. First of all, each of the local education authorities have a lot to say about exactly what school is going to look like. We're providing guidelines, but ultimately, what you just said is what's going to drive everything. Do people feel comfortable coming to work? Do parents, I think it was Norway back a couple of weeks ago, maybe a month ago, said that we're going to open our schools in the spring. We're going to open them right now. And almost overnight, 40,000 people signed on to a Facebook page that said, you're not going to experiment with my kids. Ultimately, we all have to give people, parents, students, teachers, staff members, the confidence that they can come back to school in some semblance of normalcy. Right now, I think anybody could be forgiven for saying, I still have some concerns, I have some questions. And so these guidelines are going to be designed to say, let's do everything we can to keep people safe. And that gets to things like class size, like how we operate our school bus system, like how we do sports, like how we mix online learning with in-person learning. All those things are going to be going into that, but ultimately what it comes down to is, am I going to be confident sending my child or going to an event at school myself? And if we can't answer that question satisfactorily, we're going to have trouble.
Thank you.
Okay, thank you. Thanks, everybody.
Thank you. Thank you.
Mask back on here. And thank you all for wearing your masks.
Well, we're back, and with that marathon session, quite a few things addressed. School in the fall, talking about combinations, they're working on it now. Fall sports, they're working on it now. Doesn't want to have another shutdown again. Would definitely prefer not to. Trying to open everything up. Wants more testing in the realm that it can be quicker. Definitely doing contact tracing, but it has to be hidden so nobody knows. Those type of things covered a bulk of the interview. Now, also, please remember that Mercer County and Butler County now will be green, and that will be June 5th. So that gives you a rundown. Currently 77 outside and rain. Sunshine through the weekend. So we've gotten by the rain, and I'm not going to hold you up anymore. That was a marathon session. Make sure that you tell a friend and have a friend tell a friend about Nctv45. They'll be glad you did. When they say, I don't watch a lot of TV, you tell them we're available anytime on your time. Yes, a train that runs on your schedule, that's Nctv45. Now make sure you get that second glass of lemonade and have a pleasant evening in what I call the greatest castle in the world in the county of Lawrence. Have a great evening.